All right, so welcome everyone to our monthly workshop series at the University of Kentucky offered by the Office of Work Life for our UK working parents. This month we will be talking about ADHD support and strategies for parents as you are working with your children. And I will hand it off to our wonderful speakers today and let them introduce themselves and get started with our presentation.
Well, thank you for inviting us. My name is Susan Noel, and I'm a pediatric primary care nurse practitioner and a psychiatric mental health nurse practitioner. I work in both general pediatrics and also in the developmental pediatric clinic. And in both venues, I see and treat children with ADHD. The biggest difference would be in the developmental clinic. These are children that have been evaluated in our clinic for other developmental issues such as autism, learning and intellectual disabilities, other developmentally related disorders. And the kids that we primarily treat are the ones that have what we consider complex ADHD. They have a lot of other things going on with them, maybe very young, or have a lot of other developmental things going on. So I'll let Alex introduce herself.
Thank you. Hi, my name is Alex Dulay. I'm a psychiatric nurse practitioner who also works at the Developmental Pediatrics department. I, just like Susan, I see patients who are more complex ADHD, who are either younger or have a lot of maybe other things going on that maybe we need to see in developmental rather than their normal pediatrician. So yeah, so thanks for having us. So I'll just start. So first off, can everybody see our slides? Okay. So starting off, to discuss executive function. Executive function is a set of skills that help us and allow us to accomplish daily tasks efficiently and effectively. The executive function control of your brain is your frontal lobe. Executive functioning includes, but is not limited to, working memory, self-monitoring, planning or prioritizing, task initiation, organization, impulse control, emotional control, and flexible thinking, or the ability to adjust to unexpected changes. Executive function is an important term to understand when discussing ADHD because many of the symptoms are related to deficits in executive functioning. So here are some notable statistics about ADHD prevalence. 6.4 million children age 4 through 17 have been diagnosed with ADHD. Up to 90% of these children will retain their ADHD diagnosis into adulthood. And currently 8 million American adults have ADHD, but only about a quarter of them have a formal diagnosis.
So I'm going to talk with you a little bit about some of the myths surrounding ADHD. And I'm sure some of these statements we've all heard at one time or another, or we may have even said ourselves or believed. And so we know that myths are unfounded beliefs. They lack the evidence for truth, but they're beliefs that come along because of misinformation or poorly understood information or somebody's idea. And so for some reason, though, they like to stick around and they can cause us a lot of trouble when we're trying to work through working with children and families about ADHD. So I'm sure if you have a child with ADHD, you may have heard people say, well, if you would just make them mind, if you would just set more rules, if you would just do this, and they make it as though it's a parenting issue, which we know that that is not true. I've had people who will say, well, if they can focus if they want to, because there's things that they can focus on all the time. Well, that's a preferred interest of theirs, and we can all do much better on preferred interest and maintaining our focus. But that's not how ADHD works. Girls don't get ADHD. Well, we know that that's not true. Girls do get ADHD, but they may present differently. Boys are diagnosed 3-to-1 over girls, and primarily because boys, probably 3-to-1, have more of the outward manifestations that we think of with ADHD, the hyperactivity, the impulsivity, and girls may present a lot differently. They may have more of the inattentive aspects of ADHD, or they're big daydreamers, or they have poor organizational skills, or could be just very emotional. And there's where problems come in, is because a lot of girls and females, if they're having emotional regulation issues, they get tagged with diagnoses like, well, you have anxiety or you have depression. And they might, because sometimes those things go together, which we'll see in a little bit, but their ADHD may be being overlooked. If you use ADHD medications, it can lead to substance use disorders. Well, research has proven that's not true. In fact, it's really the opposite, that adequate treatment of ADHD helps decrease the child or adult from self-treating to help with their symptoms, and can decrease the use of substances. We know that medicine is not the only answer to helping with ADHD, and we're going to talk about that here in a few minutes. And then the other one that Alex touched on, the myth is that ADHD can be outgrown. Well, there was a point in time when ADHD was thought to be just a childhood issue. But over the many years now that ADHD has been studied, and adults who either were diagnosed or weren't diagnosed in childhood start struggling in their workplace, we know that ADHD really, in many people, is not outgrown. Some of us may learn workarounds, and we're very functional in what we do. But we know that for the most part, do not outgrow ADHD.
All right, so when diagnosing ADHD, we look at DSM-5 criteria. ADHD is a neurodevelopmental phenomenon, a persistent pattern of inattention and or hyperactive impulsivity that interferes with functioning and development. Present prior to the age of 12, present in 2 or more settings. There is a clear evidence that the symptoms interfere with or reduce the quality of social, academic, or occupational function. Symptoms cannot be explained with another mental disorder. So the evaluation process is usually a thorough medical history to rule out any underlying physical causes of symptoms, interviewing the parents or guardians about behaviors, completing rating scales from teachers and parents, and assessing any co-occurring conditions. So what causes ADHD? Research through brain imaging that tracked blood flow through the brain did find differences between the ADHD brain and what we would call neurotypical brain. The ADHD brain has decreased activity or blood flow in the signaling circuits that are important for controlling impulses and in the networks that help with focus and attention. Most of the changes occur in the communication between the frontal lobe, or the executive function processing center, and in regions responsible for coordinating behaviors. Studies do show that ADHD does have a strong inheritance factor, or that it runs in families. Environmental factors can also increase likelihood of having ADHD. In the end, research on ADHD is ongoing, and but we have come a long way with our knowledge, understanding, and treatment over the years.
So in treatment, we're not jumping directly to putting everybody on medication, although sometimes you may feel that way when you walk in and that's the first thing that may be presented to you. But there's other things that go into a child being healthy who has ADHD. They need to have healthy lifestyle. So one thing is their diet. It should be a well-balanced diet of whole foods with minimal processed foods. We live in a world of processed foods. I'm guilty of going through the fast food places more frequent than I need to myself. But as much as possible, trying to make sure our kids get a well-balanced diet. For some people, artificial food dyes and preservatives can make ADHD symptoms worse. There are not real clear studies out there showing that, but there's a lot of anecdotal. There's a lot of people that can tell you, oh, if they have anything with red dye in it, they're going to be bouncing off the walls. So we know that it can happen. Nutritional supplements, a lot of people ask about. These would be the micronutrients of things like zinc, iron, magnesium, vitamin Bs, vitamin D, the omega fatty acids, omega-3 fatty acids, because we get way too many omega-6s. But these things are good for overall general health. There are no definitive studies right now that can say that these are evidence-based things that will make an impact on the ADHD brain and ADHD symptoms. But when people ask me about them, I say they're not going to hurt. If you want to do that, that is fine. There's just not a lot of evidence-based studies out there to be supportive of it as, well, let's do this instead of other things that do have the support. The biggest problem with supplements is knowing how much is enough and what is too much, because they're not as well regulated as medications, and some of the supplements out there are not regulated at all. And then some people are interested in like herbal supplements, and you have to remember that herbs are a crude drug. They're sort of, it's what our ancestors used to make drugs and medications with. And just remember, with all these products, natural does not necessarily mean safe. So finding somebody who's very knowledgeable in these different products would behoove us before we delve into just willy-nilly giving our kids some of these supplements. We also know that sleep is a huge thing for kids, even kids without ADHD. If they don't get adequate, uninterrupted sleep, they have a more difficult time controlling behaviors and being nice the next day, following directions, all those kinds of things. And when they're not getting good sleep, that means parents aren't getting good sleep. And then that just becomes a more chaotic situation when no one is getting good sleep. So we want to think about pre-bed habits, limiting screens at least an hour before, turning them all off at least an hour before bedtime. Limit what they watch. If kids are prone to having bad dreams and restless sleep, make sure they're not watching things that are potentially scary for kids. They may not be scary for us, but they may be very scary for kids. And some of the computer games that are out there are quite violent. And then the room temperature, the lighting in the room, all those things that help encourage good sleep. And then getting exercise, trying to connect the mind and the body. It can be very helpful and has been shown, excuse me, to reduce ADHD symptoms for limited time. So, your kid comes home from school, you send them out to run, get off run off some of that pent up energy that they've had. Well, we know that exercise helps with calming the body down. Other things can be like yoga, meditation, and the martial arts are great for helping kids learn how to regulate. Other treatments that can be used in helping with ADHD can be behavioral therapy. And there are a couple of different types of behavioral therapies. Some of the therapies can be very good for kids who have difficulty with planning and organizing, learning skills, kids who may have co-occurring anxiety or other conditions may very well benefit from learning how to learn coping mechanisms and social skills groups at school for kids to learn how to get along with one another and appropriate interactions. But then for some parents, there can be some good therapies out there to help you learn how to be consistent in how you manage behaviors, and also to learn skills that, you know, none of our kids came with a manual of how to treat them. And if what worked for one child isn't necessarily going to work for your other child. So learning some additional skills. But, and I'll cover this collaborative problem solving by Ross Green here in a few minutes. Then the next treatment, obviously, what we deal a lot with then is medication. And so medication for the very young child is not the first line of treatment. It is not recommended by the American Academy of Pediatrics or the American Academy of Child and Adolescent Psychiatry. Behavioral interventions, modifying the environment, putting supports in place. Those are all the things, making sure there isn't any underlying health issue, making sure that they're getting adequate sleep, all those things are first line. But if a child is not being successful there and is really struggling in school, if they can't make friends, keep friends, if the family life is always chaotic because of the interactions and behaviors, then that is a time to start talking about, well, maybe medication might be good. So which one is the right one? Unfortunately, I wish I could tell you this is the one that you should always start with. The research doesn't show that. Now, methylphenidate, which is one of the primary things that we use, there are a lot of studies on that medication. It's probably the most studied medication of all the medications for ADHD. It got a bad rap, I think, many years ago. And so a lot of people, when they hear that, because methylphenidate is the Ritalin family, oh, no, I don't want to do that. I don't want to do that. I think maybe in many years past, kids were started on high doses, and then they brought them the dosing down if they thought it was too high. But we come from the opposite perspective. We start with the low dose and build till we find the effects that everybody is good with. We never want to see a kid be a zombie. We're not trying to change their personality. We're not trying to take away who they are as a child. We are trying to, excuse me, we're trying to maximize their potential to do their very best in school and academics and in social relationships. So if you think about it, for many people, when you put on glasses, you can better focus on what you're looking at. And that's kind of how these meds are. They help people with ADHD focus. They can help them ignore distractions, pay attention, control their behavior. Just remember, medications don't cure ADHD. They can help ease the symptoms of ADHD and help the child function more effectively. So stimulants are the best and the most common type of medication that's used. And there are two families of stimulants. I've already mentioned the methylphenidate family, and under that, that's the active ingredient in Ritalin, Concerta, and there's other formulations in that family. And then the amphetamine family, which is the Adderall and Vyvanse, and then there's some other formulations in that family also. And they work by increasing the levels of chemicals or neurotransmitters in the brain that help activate the parts of the brain that are not effectively functioning. Every child is different, so there's no one right one. And the other thing that we have to think about in kids is that the dosing. So if your child has an ear infection and I see them in clinic, I know that there's specific antibiotics that work well on ear infections, and you give X amount of antibiotic for every pound of how much your child weighs, and it will take anywhere between 5 and 10 days for that ear to clear. But that's not how ADHD works. Unfortunately, it is a little bit of trial and error, and we really depend on feedback from teachers and especially the parents to help us figure out, is it enough, not enough? Is this really the right one? Should we try another one? So we want to work with you on this, and we need your input. Even the long-acting medications that say they will last up to 12 hours in a child, they may only last 10. And in some kids, we're lucky if it lasts 6 hours because of their metabolism. So there's a lot of things, a lot of moving parts as we're doing medication that we have to work with. What about medication rebound? And some of you may have experienced this with your child, that as the medication wears off, all of a sudden there's this extreme irritability or moodiness, or that they seem to be more hyper and more impulsive. And that is a real thing. And it happens because as the medication is wearing off, then there's not that stimulation to those parts of the brain to control the movement or to help with the attention. It occurs more with the short-acting ones, but it can occur a little bit with the long-acting medications. And so some things that you can help offset this: when your child comes home from school, one of the major side effects from the medications is decreasing the appetite. They may be hangry. So have a really good snack for them, something with protein and carbs, so that they can, and get them out and get them moving, get them moving around, and that can help offset some of that decrease in the effects of the medication in their system. For some kids, that's just not enough. And late afternoons and evenings are extremely difficult for them and their families. And so the American Academy of Pediatrics and American Academy of Child and Adolescent Psychiatry does recommend trying a small dose of a short-acting medication in the same family, and that can help smooth out those effects of the medication. Other things to consider are trying to do homework as soon as possible after school, so that if there's any medication still in their system, they can more effectively focus and get that done. Alex, you're muted.
This is the ADHD iceberg, which is one of our favorite analogies about ADHD. ADHD is like an iceberg at times. On the outside, you may only see the fidgeting, distractibility, impulsive behaviors, or hyperactivity. But under the surface, individuals commonly struggle with much more, like sleep issues, mood shifts, poor memory, relationship challenges, and emotional dysregulation, to just name a few.
So we do know that with ADHD, a lot of kids have other things going on too. And like Alex showed that iceberg, some of these are underlying. You may not realize some of these issues are there because the hyperactivity or impulsivity is so overwhelming. And you may not even realize some of these things are going on until the ADHD symptoms get a little bit better managed and controlled. But about 65 to 80% of kids with ADHD are going to have a second condition. And this actually really can complicate the picture of ADHD. And so again, we really depend on working with the families, working with those who are around the kids a lot to try to tease out what is going on and what needs to be done. The rule of thumb for us is that if the other condition is more severe than the ADHD, then treat the other condition first. And then when it's stable, come back and we'll treat the ADHD. And this diagram just shows that from this site that about 67% of kids with the ADHD have at least one other co-occurring issue going on. 33% of those kids have one condition, 16% have two, and 18% have three or more. So it's not uncommon for us to also be treating more than just ADHD. And this is where the whole complex issue comes into play.
So we wanted to talk a little bit about support. So obviously, school is a very important part of our child's everyday life. According to the American Academy of Pediatrics, when a child has ADHD severe enough to interfere with his ability to learn, 2 federal laws offer help. The Individual with Disabilities Education Act, or IDEA, Part B, requires public schools to provide or cover costs for evaluating the educational needs of the affected child and providing the needed special education services if your child qualifies because his learning is impaired by ADHD. The diagnosis alone will not necessarily qualify your children for these services. So basically, they have to be below average in their grade level for various education benchmarks. The Section 504 of the Rehabilitation Act of 1973 does not have strict qualification criteria, but is limited to changes in the classroom, modifications in homework assignments, and taking tests at less distracting environments or allowing more time to complete tests. Usually the diagnosis alone will qualify your child for services. Pictured here are 2 toolkits that we recommend for families and teachers also to help navigate the IEP and 504 process. So there's the CHAD ADHD in School, and then the Attitude Magazine, the Ultimate ADHD Toolkit. So both of these can be found online and have lots and lots of resources and recommendations for various issues that might be occurring in school due to the ADHD.
So some of the resources that we recommend for our families include a YouTube series that Dr. Adele Diamond has out there explaining executive functioning. And it's very easy to understand. She's got several different YouTube vignettes out there. Alex has already mentioned the Attitude Magazine. It is an online place. They have lots of webinars that are done by professionals. They have information on nutrition, behavior, family dynamics, medications, education, etc. Sometimes people post their concerns. My child is doing XYZ, you know, what resources are out there? So there's a lot of information out there. I have one mother, when I told her about this, she subscribed for the one in print. And she said, I can't wait to get that magazine. And I go through it page by page. I have learned so much from it. And part of it was she didn't feel like she was alone in some of the struggles that she was going through. This isn't just my child that has this, and other people have the same things going on and they're receiving help. Chad has a National Resource Center on ADHD. It is a national clearinghouse for materials on ADHD, and this ADHD in School, a toolkit for parents of children with ADHD, is found on their website. Some other things that can be useful to help kids. There's an executive functioning workbook for kids. And so these are practical, hands-on kinds of things that you can do with your child to help them develop their executive functioning skills. And sometimes there's ideas in there of things that you might suggest to their teacher to try to help them. Things that you might want to include in their 504 plan or in their IEP. Another book that many people find useful is The Smart But Scattered, and they also look at the executive skills approach to helping kids. There's a workbook, Thriving with ADHD, and social skills activities for kids. So this one here by Dr. Ross Green, the last two, The Explosive Child, and then his program that he has called Collaborative and Proactive Solutions is found at livesinthebalance.org online. He has trainings on this. And what he does is help you look at what are some of the core issues that may be contributing or triggering some of the behaviors that are seen, and how do you work through them. And it's a very step-by-step approach. It's very accessible, and I think for a lot of people it can be very beneficial to work through it as a parent, and then helping to figure out what works, and then sharing that also with the schools. This seems to work at home, maybe this would work at school if there's ongoing behavioral things. So we'd like to open it up to questions. We work with a lot of colleagues who support us in this work, both from the Department of Developmental Peds and from UK Pediatric Psychiatry. So if we don't feel like we know the answer to what you have a question for, we can always check into things and try to get back with you too. The first question is, where would you get occupational therapy? There are several different agencies around in all of the surrounding counties, and the developmental clinic has a list by county of available occupational therapists. I will say most places have a waiting list right now. An occupational therapist, that's a great resource for helping with modifying behavior, social skills, plus if there are any fine motor or other motor type skills that are delayed. Somebody asked, are non-stimulants effective? Yes, they can be. They're not typically first line, but they can be effective. I have found from personal experience that if your child has the combined inattentive and hyperactive ADHD, that the non-stimulants like Strattera, now Qelbree, are not as effective for helping with the motor behaviors. But for focus, attention, they can be very helpful. I will have to tell you, you're throwing these in here fast. Whoever put in any resources to help teachers overcome stigma and implicit bias. Other than taking a course on implicit bias, I haven't seen anything specifically related, but you know, dispelling some of those myths surrounding ADHD can be a big struggle, not just with parents and guardians, but also with other relatives. You know, I know people who won't tell anyone they have their child on ADHD medicine because they're afraid of what people are going to say to them, because of the stigma and the myths. And unfortunately, it is still there for teachers too, but yeah, Alex, do you know of any good resource for that?
I'm sorry, I didn't hear the question.
About resources for teachers to overcome stigma and implicit bias? I've not seen anything specific for that.
No, honestly, I haven't seen anything, but we can definitely ask around it with our psychologists to see if they recommend anything. See a question, did we answer, have you seen an increase in ADHD diagnosis? Do you feel it's overdiagnosed? Did you see that question? Did you answer? I know that there has been, I think, an increase, especially in adults being diagnosed with ADHD. I think the American Academy of Psychiatry might be working on more of regulations about diagnosing adults, because a lot of it is based on what they tell you. Children, however, I think if you're very thorough and conservative in your diagnosis, where you're asking a thorough interview with parents and school, at least I think that I haven't seen that in children. What do you think, Dr. Noel? An increase in ADHD diagnosis or being overdiagnosed?
I guess I have a bias here. When they're coming to us, usually families have already been through some process of working with the school or the daycare or their PCP about their child's behaviors or concerns. So in the developmental clinic, especially, by the time they come to us, I don't think that the overdiagnosis of ADHD is probably there. Sometimes it's more of determining, is there something else going on also that may have been overlooked or not thought of? I think we're all more aware of it, maybe more so after having to do virtual school. And I think a lot of parents who may not have wanted to go that route, maybe they're concerned about a label on their child, or they just really didn't see what teachers were seeing at school. Once they had to stay home with their child and do virtual school, they saw the lack of focus, the inattention, all that kind of stuff coming through. I will tell you, there were a lot of kids that did very well with virtual school because they could chunk all their work together and get it done and get it over with. And a lot of kids went off their meds during virtual school because they weren't being made to sit in a classroom and stay in a structured environment all day long. So it kind of went both ways during the pandemic, shutdowns and stuff. I do have people in general pediatrics sometimes who are concerned about ADHD, but once we gather all the information in the Vanderbilts or whatever forms they're being filled out, sometimes it doesn't point to that. And so it's more sitting down and discussing what other options are there? How do we go about dealing with some of the behaviors maybe that they're experiencing at home or other places? Andrea asked about, they're at the beginning of the process, just getting the assessments filled out. What does the process look at UK? Enroll the PCP, refer for therapy. So ADHD can be managed effectively by a primary care provider. And in fact, we're really encouraging the primary care providers to help us more with that. Psychiatry is trying to do that, and development is trying to do that. So if the child is not responding well to the medication, or there are other complicating things going on with the child, then that's a good time for a referral outside of the PCP office. But most PCPs can manage ADHD. Now, some of them don't want to, because in order to do that, you have to have your DEA license, and a lot of them don't want to do that. And so that's understandable. But at UK, especially in general pediatrics, we have several pediatricians who manage their own kids who have ADHD and are doing great. The kids are doing great. And I guess that's kind of.
This is a good question. We heard that trauma/instability can cause symptoms that seem to mimic ADHD/ADD. Is this true in your experience? I would say yes. We do see what we would call a trauma developmental disorder, where there's issues with, symptoms that are very similar to ADHD. That lack of inhibition, trouble with relationships, distractibility, but treatment-wise, I think you do have to consider the trauma element in that situation, and addressing the root cause of the behavior. Dr. Noel, Dr. Noel's the expert in trauma, so
as part of my background experience, I worked over at UK Center on Trauma in Children and did trauma therapy with kids. And this is something that, yes, we saw a lot, that a lot of behaviors and symptoms that we saw were being treated as ADHD. And sometimes it was helpful. Other times the symptoms really didn't get better until we worked through some of the trauma, which can be a long, difficult process for some kids.
Now there's a question, what is the difference between ADHD and ADD? So now when diagnosing ADHD, it's a umbrella known as ADHD, period. And that umbrella contains the ADD, or the inattentive type, and the hyperactive type of what we used to just call ADHD. But so there's ADHD, either inattentive type or hyperactive type, or there's many of our children that we treat are the combination type, where they have both the inattentive characteristics and the hyperactive. We're in trouble with impulsivity. So we don't usually use the ADD term anymore in our practice. But
backing up, I see somebody asked about the ADHD assessments being offered at a few hundred to many thousands. I'm assuming that's dollars to be done. And yes, it can be a lucrative business out there. The different kinds of assessments, really, they need to use an assessment that has had research that shows consistency in identifying the behaviors that are associated in symptoms. I keep saying behaviors, but behaviors and symptoms that are associated with ADHD. There are some that are free. We use the Vanderbilt assessments all the time. The Connors is another one that has to be paid for, either insurance or out of pocket. But there are a lot of other assessments also that can be used. but I'm assuming that part of this assessment process is you are paying the person doing it outside of the insurance, or there are a couple of other assessments that I know that are being offered, but they're sort of like Alex had mentioned some of the scientific studies of the brain. Those are called functional MRIs, but those are used only in academic settings and in research studies. There are a couple of other ones, and I'm sorry, I'm drawing a blank on the names of them, but there's one that's sort of like an EEG to look at brain waves. I don't know, I have not seen the research on that really shows that those are definitive and evidence-based. I think they're wanting to get more data to help with that, but I am not aware of any of those. Sometimes people ask us about doing the genetic testing for medication. And when they came out with that, it was used a lot in the very beginning to help try to determine which med would be better for a child who may not have been responding well to medications. But what they found was it really did not help when it came to ADHD meds. It helps more with other kinds of medications like meds for depression and anxiety. It can help a little bit better with that. I do know that one of the psychiatrists that we work with in development, if a child has really kind of what we would call run the gamut of medications and nothing seems to be helping, nothing is improving, she has done some genetic testing, swabs, to see if there's something there that is just an outlier. But it's not a routine thing that is done. And the American Academy of Peds and the American Academy of Child and Adolescent Psychiatry do not recommend them because of the lack of evidence showing that they're beneficial. And they're expensive. Sometimes those can be $1,000 or more to do if your insurance doesn't pay for it.
Any suggestions on helping a high school age student who is gifted but underperforming and as in doesn't keep up with assignments, who resists to taking meds or continuing counseling? Oh, well, I'm sure we see a lot of children like this, but I guess understanding what the reservation is for taking the medication. Is it the lack of appetite that, the appetite suppression is, what exactly is their reasoning for not wanting to take medication? I don't know if your provider can talk to the teenager and kind of educate them on really what the consequences of not taking medication through those pivotal years of life, where they're trying to learn those executive functioning skills, and also kind of setting that path for adulthood. We've seen it a lot where children will try not to take their medication during those, teenage years, and, there are consequences where they make impulsive decisions. No, Dr. Noel, what kinds of ideas and recommendations do you have in that situation?
I think that's a very difficult area. I personally do not have a lot of good solutions for that. I wish I did, because then, hey, maybe I could market that. But I try very much to involve the kids that I work with into the decision making about their medication, and try to help them understand why they're taking it. It's not a magic pill. It's not gonna make you smarter, because it's just gonna help kind of slow your brain down a little bit and open up the channels for you to think and focus a little bit better, so that you can make good choices and decisions. Still your decision. I just saw a kiddo today, and I told him, I said, if you decide you're not gonna do your homework, that's still your decision. I can't, those pills aren't gonna make you do your homework. You're not gonna get straight A's. And I think in adolescence, it's a stigma for them too. So trying to get medications such that they don't have to take them at school, nobody has to know they're on meds. This is an area where when kids get off track, it's in the adolescent phase, because just like you say, you can't make them take their meds. You can take them to counseling, but if all they do is just sit there and refuse to talk, and the counselor's going to dismiss them from counseling. But part of it too is trying to figure out, so what is it about taking the meds you don't like? Tell me a little bit about it. And getting them in the room alone, not that they're talking in front of their parents, so that they can really be honest with you about it. But you've got to have a good rapport with them in the beginning too. You can't just, if I don't know your child, I can't march right in there and say, okay, tell me, why aren't you taking your medicine? You've got to have that rapport built with them to help them work through that. One thing that I start implanting in the brains of parents and kids before around the preteen teen years is, hey, you're 13, 3 more years, you're going to be driving a car. Guess what? You have ADHD. You cannot drive a car unless you take your medicine and start taking it on a regular basis, because you're not going to be safe. You're going to be distracted. You could hurt yourself. You could hurt other people. And so kind of getting that into the thought processes of, this is for your benefit. This is for your good. You want to drive a car? This is something that we're going to have to work on together. I'm sorry, I don't have good answers for that one.
From what I understand, there can be an overlap in ADHD and trauma and diagnosis. Would you happen to have a list of local places that provide therapy service geared towards these diagnoses for a middle schooler who is resistant to traditional talk therapy? Would you recommend trauma-focused behavioral therapy in this situation? I know key assets. I don't know about someplace here in at UK. Do you know, Dr. Noel?
Any therapy that is trauma focused would be where I would aim for. I don't have a particular list of those.
I know we've sent referrals to key assets in the past, is one that comes up in my mind, but you send our email.
And children really focuses on the trauma part of it. But I know that they've had a long wait list in the past, and just like with other therapies, everybody's got a wait list right now.
Speaking of driving and teens, do you have any resources for ADHD teen drivers in Lexington? Are there any support groups or resources for transitioning into adulthood?
You guys are asking some really good questions.
Those are good questions. I had one of our psychologists recommend
so that we can look into them further.
Yeah. Yes, so we only have a few more minutes, I think. Anybody have any burning questions?
There's a question on here related to supporting a girl with ADHD who presents differently than boys.
Okay. Um,
I would recommend the attitude. They have a lot of information out there about the difference between ADHD in girls and boys and presentation. I think you will find a wealth of information on that website. I go down a rabbit hole sometimes on that website. I start looking at one thing and then it links to another, and before I know it, I've been on looking at things for an hour or more, and downloading copies of things and all kinds of stuff. So that I think would have a wealth of information there. And I think some of the issues with teens, you might find some answers there, practical things, because these are people in the trenches. Alex and I see, I'd say most of our clients are school age and younger. I'm starting to get a few more kids who have finally graduated into that teen phase. So some of these things are going to start hitting me coming in with some of my patients. So I thank you for bringing up these concerns, because I'm going to definitely look into some of these concerns and talk, like Alex said, with our psychologist and with some of our other peers who may have more experience working with the adolescents.